We have a panel of experts, doctors, and Clay Kerner from the health insurance field joining us tonight here on set, and we want to introduce him. Clay Kerner here from Alliance Wellness, or Alliance Insurance Brokers, and Dr. Robert Gross and Dr. Holly Spohn-Gross, also from the Sienna Wellness Institute from the Kern River Valley. Thanks for joining us tonight.
Thank you.
Of course, the big question is tonight, is now the time for health care reform? Clay?
Well, I think we need some kind of reform, but I'm not sure that having a public plan is the answer.
Doctors?
Why do you feel that?
I think that everybody should have access to care, and just about everybody does have access to care right now. All they have to do is go to an emergency room, or there's numerous plans available currently to put the government in charge of your health care, as they are in charge of the post office and several other organizations. I don't think is a good move, and I don't think financially the country's in a position to fund health care directly.
Well, as doctors, you're on the front line, of course, in the medical field, emergency room care. What do you see out there?
Well, I do most of my work at the hospital, and unfortunately, Clay's right. People are using the emergency rooms as primary health care, and that's incredibly expensive. It's not really an efficient way to practice medicine. We're waiting until people are exceedingly ill before they actually show up, and with a public option for competition against private health insurers, I think we could actually bring down the cost and allow people to be able to see their primary care physician whenever they feel that it's necessary.
And what do you think about the public option that would give people the choice, according to the Obama administration, of having an option to use government-run health care versus private insurance care?
Well, I think you have to look at the actual bill. Here's a sample of the bill, and it's up for interpretation. Really, who's going to interpret the bill? As far as the funding of it, this country can't afford to fund socialized medicine. I do agree that everyone should have coverage. I think if everybody had coverage, we wouldn't have a problem with health care. It would reduce the cost all around. I'll give you an example. In New Jersey, an individual 30 years old can buy a $1,000 deductible plan for $900 a month. In California, that same plan costs $100. Now, what's the difference? The difference is that in New Jersey, they don't have to ever buy the insurance until they actually need it. So they wait to buy the insurance. That's why their premiums are so high. That's why several carriers have left the state. What we need is everybody to have health insurance, everybody to pay a fair price. If they can't pay it, the government can offer different type of programs. Realistically, there's about 15 million people nationwide, when you really look at the bottom line, that don't have insurance. Those are the 15 million we should be concentrating on.
And some estimates are 47 million. Yeah. What do you say to those people, though, that are out of luck right now, out of jobs, don't have the health care insurance?
Well, I think that they can get access through, as the doctor said, through the emergency room, and it's unfortunate. If they would have purchased it when they had the opportunity, maybe they wouldn't be in this problem today.
Now, as doctors, what does that do for you if you have to provide health care for just someone that walks into the ER?
Putting profit before people is not the answer to health care. We have to have something affordable for everyone. We, as a society, when our society is weak, the weakest link destroys our economy and our structure.
In fact, there are foreign countries out there that have health insurance where you just pay the premium, but there's no profit involved. Can something like that work here in our country?
Well, I think France is a prime example. France has a great system to some extent, but France only covers its citizens. Now, the majority of our uninsureds are non-citizens and illegals.
I don't agree with that. I'm sure that there are statistics that may bear that out, but I would question where those statistics actually come from. But I would say, first of all, on one of the points that you made before, there are no doctors that I'm aware of that are for a socialized medicine system. This program that we're talking about, and this is 5 bills. Clay's absolutely right. There really is no bill yet. There's no Obamacare out there, and the public option is not socialized medicine. I will not work for the federal government. My wife will not work for the federal government. Hospitals will not be owned by the federal government. We will just the federal government will supply insurance that will allow people to see us. Currently, we have Medicare, which is a wonderful program that has overhead of around 2.5 to 3%. Private insurance ranges anywhere, and I'm sure I'll be corrected on this, between 10 and 30%. With that difference alone, we can fund this program.
Well, you say you won't work for the government, and I think that's wonderful. I don't want to work for the government either. The problem is, once the camel gets its nose under the tent, it's just going to continue to grow. Here's an example. Here's a page right here that's probably got 15 different government programs currently available. So when you say there really isn't access to insurance, there's really a lot of access for coverage for just about anybody in this country today, especially in California.
Yeah.
And you will work for the government eventually when you read the bill, which I have done.
Let's talk about another part of the plan, paying medical providers for so-called bundled care. In other words, instead of getting paid for each separate service for every test, pill, or operation for a problem, the provider actually gets paid in one lump sum. So the idea is paying for quality of care, not quantity of care. What are your thoughts?
Actually, I think technology will step in and help with that, so that when you go to your primary care physician, everything we put in a technology-type base where people can access the healthcare system, technology system, and then when they go to another doctor, they won't have to run the same tests over and over again. And I think that's the direction that Obama wants to take us. I think Kennedy wanted to take us that way. And I think both doctors will agree that we need to have some kind of centralized control for tracking. A prime example of a good company that has that program today is Kaiser Permanente.
Dr. Spohn-Gross, what are your thoughts?
I just have a hard time believing that right now our insurance companies are dictating how we practice medicine. And until that is on a playing field that's equal, we can't continue with health care.
So you'd rather have a legislator that does nothing about health care dictate how it's going to be done?
Versus somebody that's all out for profit? You bet you I would.
Well, a number of the insurance companies are nonprofit. Kaiser is a nonprofit organization. Blue Shield is a nonprofit organization. The government, I think, is a for-profit organization. Tax and spend,
So insurance, though, isn't for profit, though?
No, there's a lot of for-profit companies.
And can I also jump in here? I've never once been told by Medicare, Medi-Cal, or any public insurance how to practice medicine. On a daily basis, I'm contacted by insurance companies, told to send patients home before they're ready to be sent home, not allowed to use medications that would actually cure them, because the insurance companies say that they will not pay for them.
That's obviously a huge problem with everyone out there. They've come across that when they've gone to see the doctor. The doctor has to get on the phone to call the insurance company to say if they can go on the procedure.
To have an amputation of a gangrene toe, I've fought very hard for patients to have that, and they've said, no, we deny this care. This patient's too high a risk, too old, is not going to make it.
So who has the death panels really? Private insurance or federal?
So who has them today and who have them tomorrow?
So how do you solve that issue?
I don't have the solution. I wish I did. If I did, I wouldn't be sitting here tonight. We all have to work together to try to make the systems work for everyone. But we have to also be cognizant of the expense that we're going to face.
And we're talking, what, $1 trillion for care over 10 years time. Mm-hmm. That's the big question, too. Who pays for all this? How do we decide to do that? On the backs of people that are millionaires or the backs of taxpayers as well?
I think that's another question that has to be looked at when you look at the total economy and where we are today.
But when you're looking at right now where this cost is, doctors are not getting paid more for doing their services. Patients are being cut less for what they're offered. It's the CEOs, it's the companies that are making the more money. It's not the other way around. We're not giving more care, and that's what I am fighting for, as an advocate, as a patient advocate, to help our patients.
I guess we need another czar.
Yeah.
The two fastest growing areas in medical care right now are insurance premiums and prescription drugs. That's what needs to be controlled. We should not be having a debate here about health care reform. It should be health insurance reform.
All right, we've got to cut you off, Dr. Gross. And Dr. Gross, are married, by the way. Clay Kerner,
Thank you very much.
And we were actually going over an email question that came into us at viewer@bakersfieldnow.com. And again, if you have questions, feel free to email them in, Twitter us, and also call the Problem Solvers hotline. But this one was in regards to a person who had said that her mother actually had contracted MRSA from the hospital and was released because Medicare wasn't able to fund her. I guess, we had asked you about this. What was your answer to that?
Yeah, it would be very unusual, actually, for Medicare to decide when a patient were to go home. I mean, I never get a phone call from Medicare saying now it's time for that patient to go home. So I think it could be a privatized form of Medicare called Medicare Advantage that maybe could have made a decision.
Okay, and then what's next after
that? Or
that?
maybe the physicians taking care of the patient felt that she was well enough to go home. But Medicare itself is not going to deny that stay or tell somebody that they have to go home.
Okay, very good. So good question and good answer as well.